If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, everyone. This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today, we'll be reviewing 3 anatomy questions. A reminder that you can find these questions and many more on our website at medprep2go.com. If you'd like to get involved in this project and learn how to develop USMLE-style questions, feel free to email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe, give us a review, and let your friends know about this podcast and our website. And if you want to learn more about me and my books and other projects, check out tedxoconnell.com. All right, let's get started with the first question. A 6-week-old baby boy presents to the clinic for evaluation. The mother is concerned that her baby is having difficulty moving his left arm. The prenatal course was unremarkable. The baby was born via vaginal delivery at full term and weighed 8 pounds, 9 ounces at birth. The mother mentions that the baby's head became stuck and that they required forceps to assist with the delivery. Physical examination reveals a healthy baby whose weight is 10 pounds, 6 ounces with an appropriate length and head circumference. There is absent deltoid and biceps function in the left arm. Function in the left hand seems to be normal. Which of the following nerve roots were most likely damaged in this patient? A, C3-C4, B, C3-C4, C, C5-C6, D, C6-C7, or E, C8-T1? The correct answer is C, C5-C6. This patient is suffering from herb palsy, which most likely occurred secondary to a traction-related injury during the complicated delivery. Patients with herb palsy have damage to the upper trunk, C5-C6, of the brachial plexus. Patients with herb palsy have weakness of abduction from deltoid paralysis, C5, weakness of external rotation from infraspinatus paralysis, C5, and loss of flexion from biceps paralysis, C6. The internal muscles of the hand are unaffected. The result is an arm that hangs limply by the side in extension and internal rotation. Injury is usually caused by shoulder dystocia, resulting in traction on the shoulder, which damages the upper brachial plexus roots. Answer choice A, C3-C4, is incorrect. C3-C4 is not part of the brachial plexus, so injury to these nerve roots would not result in the findings seen in this patient. Answer choice B, C4-C5, is incorrect. C4 is not part of the brachial plexus, so injury to this nerve root would not result in herb palsy. Answer choice D, C5, C7 is incorrect. Damage to C7 is not part of herb palsy. Injury to nerve roots C5 to C7 can result in injury of the musculocutaneous nerve, causing an inability to flex or supinate the arm. Answer choice E, C8T1 is incorrect. Injury to the lower roots of the brachial plexus at C8T1 causes total clawing of the hand because of paralysis of the lumbricals and finger extensors. This is known as Klumpke palsy. The key learning point: herb palsy results from damage to nerve roots C5, C6, and results in weakness of abduction from deltoid paralysis, C5, weakness of external rotation from infraspinatus paralysis, C5, and loss of flexion from biceps paralysis, C6. Question 2. A 40-year-old woman presents to the emergency department with left hand pain after a fall onto an outstretched hand just 1 hour earlier. Her pain is located on the radial side of her wrist. She is right hand dominant and has no medical or surgical history. She occasionally drinks alcohol, but does not use tobacco products or any illicit drugs. She works as an office secretary. Physical examination reveals no bruising or swelling, but she does have tenderness located on the dorsal surface of her radial wrist, just proximal to the carpal metacarpal joint of her left thumb. She also endorses pain with axial loading of her left thumb. She has full range of motion in her wrist and fingers, with sensation fully intact and 2+ radial pulses bilaterally. X-rays of her left hand, wrist, and forearm are all negative for any acute pathology. Which of the following next steps in evaluation is most likely to reveal the diagnosis? A, CT scan of the left hand and wrist. B, fluoroscopic imaging of the left hand and wrist. C, MRI of the left hand and wrist. D, open reduction internal fixation of the left wrist. Or E, repeat X-rays in 24 hours. The correct answer is C, MRI of the left hand and wrist. MRI imaging is the most sensitive modality for diagnosing occult fractures of the scaphoid bone. Scaphoid fractures are most common in younger to middle-aged adults after a fall onto an outstretched hand. Pain at the anatomic snuff box region, the dorsal surface of the radial wrist, just proximal to the carpal metacarpal joint of the left thumb, is a common exam finding, as well as pain with axial loading of the thumb, which puts pressure on the scaphoid as it articulates with the proximal metacarpal bone of the thumb. Answer choice A, CT scan of the left hand and wrist, is incorrect. A CT scan will give more clarity than a plain film X-ray, but an MRI is the most sensitive and specific for occult scaphoid fractures, and CT scans are often reserved for preoperative surgical planning. Answer choice B, fluoroscopic imaging of the left hand and wrist, is incorrect. Fluoroscopy will not add any diagnostic clarity, as this imaging often has less clarity than X-rays. Answer choice D, open reduction internal fixation of the left wrist, is incorrect. Open reduction and internal fixation of the wrist is overly aggressive and not indicated at this time. Answer choice E, repeat X-rays in 24 hours, is incorrect. X-ray imaging is often negative for 1 to 2 weeks following injury. The key learning point: scaphoid fractures require a high index of suspicion in order to properly diagnose, as X-rays are often negative for 1 to 2 weeks following injury. They often present with pain in the anatomical snuff box region of the hand, and MRI is the most sensitive imaging modality.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at MichelobUltra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at MichelobUltra.com/courtside for free entry deadlines, prizes, and details.
Question 3. A 24-year-old woman is transported to the emergency department by ambulance following a motor vehicle accident. She is noted to have facial lacerations on the left and a small amount of blood in the external auditory canal. If the facial nerve is damaged during its course through the external auditory meatus, which of the following senses will be compromised? A. Facial sensation. B. Lacrimal gland secretion. C. Muscles of facial expression. D. Taste sensation to the anterior 2/3 of the tongue. Or E, taste sensation to the posterior 1/3 of the tongue. The correct answer is C, muscles of facial expression. The facial nerve enters the internal auditory meatus, courses through the facial canal, and then exit the temporal bone through the external auditory meatus. While the facial nerve has sensory, motor, and parasympathetic functions, the specific nerve fibers exiting the external auditory meatus are responsible for innervating the muscles of facial expression. Answer choice A, facial sensation, is incorrect. The trigeminal nerve is responsible for facial sensation. Answer choice B, lacrimal gland secretion, is incorrect. Facial nerve functions such as lacrimal gland secretion are associated with the geniculate ganglion in the facial canal. Answer choice D, taste sensation to the anterior 2/3 of the tongue, is incorrect. Facial nerve functions such as taste to the anterior 2/3 of the tongue are associated with the geniculate ganglion in the facial canal. Answer choice E, taste sensation to the posterior 1/3 of the tongue, is incorrect. The glossopharyngeal nerve is responsible for taste sensation from the posterior 1/3 of the tongue. Key learning point. The facial nerve enters the internal auditory meatus, courses through the facial canal, and then exits the temporal bone through the external auditory meatus. The nerve fibers exiting the external auditory meatus are responsible for innervating the muscles of facial expression. That's it for this episode, but please do check out our other episodes. And just a reminder that you can find all of these questions and many more at medprep2go.com. And if you want to see the source material behind many of these questions, please check out the Crush Step 1 podcast.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.